Yeah, when we were talking about the immune system and inflammation in the heart, and there's several things. I mean, the heart is such a a can of worms, really. That
Yeah.
so like all the things that influence blood pressure and high cholesterol and the factors that would cause like tachycardia and some of these types of issues that a lot of people struggle with now. But um, there are some things that we can help to do that will help to lower cholesterol, will help to kind of break up some of the triglycerides and help that person who struggles with higher cholesterol in general. What I
Yeah.
find is like a lot of people are just it's kind of a mixed bag here. When I'm meeting with people, they'll see something on the internet and get on a product, and then they'll add additional one 6 months or a year later. And then, you fast forward 5 years and they're on to a laundry list of supplements that really don't make a lot of sense. Doesn't seem like they're
Mhm.
very well coordinated. Like red yeast rice for this, and then they'll take an iodine for something else. And certainly with the heart, a lot of people are concerned. They don't necessarily want to just add another pill, whether it's another supplement or whether it's another medication. I find more and more
Right.
people want to reduce the dependency on that. Um, but how can we have more of a strategic plan? And what are some of the things, like as an example, um, niacin sustained release as one
Yeah.
example that can help with things like cholesterol?
Yeah. So the way that I think about cardiometabolic support, it is a complex product. And so I myself am a patient, right? I also have cardiometabolic issues. So the way that I think makes most sense when you're trying to target things with supplements is to always start with a strong base, see where that takes you, and then know that you have other tools in your toolbox to add on to that. So when I think of cholesterol actually as a base support, I think of Lipi Bergamot as the base of what you would use to maintain proper cholesterol. And the reason for that is because certain things that you can take, like niacin, is targeting one aspect of cholesterol, where Lipi Bergamot, if you look at some of the research with it, looks at LDL impacting HDL levels, improving triglyceride levels. There's fantastic studies also looking at the efficacy of taking Lipi Bergamot in combination with rosuvastatin, which is a statin medication, showing that if it's a patient that maybe is on a prescription, but maybe they're stagnant and they're not getting to the next level, like this is a great tool to add in safely that you can add on to a protocol to be more effective. And it also has fantastic research and looking at other cardiometabolic areas. So Lipi Bergamot has also been effective at reducing liver enzymes. It's also been studied for HbA1c. So again, that concept of metabolic syndrome, it's a really good product, not just for cholesterol, but I think as a core in general for patients, because often you'll see people that have issues with insulin sensitivity, they eventually are going to have cholesterol issues and vice versa. So this is a really good product that attacks all of those. And the best part about it is it doesn't deplete CoQ10 levels. So you mentioned earlier, not just statins, but things like red yeast rice, and why I think it's so important, if I could stress anything, that supplements are just taken from healthcare providers, because you know that you're using a product that has been tested, that it's safe to take, and that there's specificity in what it is being used for.
Hmm. Hmm. And red yeast rice being one of those ones, it's like, there's new data out there. Maybe it's not as new, but
Yeah.
there's other things that can be more helpful without depleting CoQ10, and the bergamot product is one of those.